test for the live stream. Sound works?
Yeah, the green sound thing here is working too.
All right.
I unplugged the microphone. I'm sorry.
No, my fault.
Okay.
Okay. All right. So now we're officially going to get started. So again, welcome everyone. Glad to have you guys here in person. And for those of you joining us live stream, this is our inaugural live stream, so we were able to work through some technical difficulties and get you guys here live as well. We definitely want to thank you all for joining us. We do want to recognize our investors, because without them, we wouldn't be able to host events like these and be able to congregate and commune together. So thank you to all of our investors that invest in Onward. We do want to take some time to recognize our elected officials in attendance. We do have Joseph Guthrie with Board of Supervisors for Pulaski County and Sherry Blevins with Montgomery County. And then we also want to take a second to recognize our chairman level investors. We have Carilion New River Valley Medical Center, FTZ 238, Montgomery County, Pulaski County, Virginia Tech, and our president level investors, Atlantic Union Bank and Trust, Block 1 LLC, BAE Systems, Branch Builds, Celanese Corporation, City of Radford, Cowan Perry PC, Floyd County, Giles County, and Lewis Gill Hospital Montgomery. And we also wanted to thank our event sponsor, Cowan Perry PC as well. We also want to recognize our Board of Supervisors that are in attendance as well. We have Keith Boyd with Hurt and Profit and Joe Guthrie with Pulaski County. So we wanted to say thank you all for being live with us in person. Onward New River Valley board members, thank you. We wanted to say thank you all for being here in person, and thank you for watching live stream as well. So I will introduce our Executive Director, Charlie Jewell. We'll have him come up so he can give the Onward NRV update.
Yep.
Well, welcome everybody. This is definitely a first. I was reflecting back as to what to kind of say today, and it's very interesting. At our March 12th event, that was the last day that things were open. So I was very excited that we were able to get that in and had great attendance at RU that day. But if you go back in time with me, that was certainly a different world that we lived in then. And I know for myself that day, I did not know what was going to transpire over the next few months. So, with many people and businesses trying to adapt to the new world that we're in, that's certainly been the case with us. So a little bit of an update on Onward NRV. Our staff, we did work remotely from pretty much the whole month of April and May. And we had some discussions early in June about opening the office back up and making sure that we were coming up with a plan on how to do that safely. And that was interesting being in economic development, because prior to really the end of March, public health wasn't really part of economic development. But it's really strange to see how diverse of a topic economic development can become. So after spending a couple months just watching companies and trying to understand how they were adopting and adapting, we took those steps ourselves and began, entering back into the office. So we're fully back in the office now, practicing good social distancing, wearing masks or wearing common areas, the new normal of what office work looks like these days. So, and we're still adapting, as many of you all are. In terms of the region, I thought I would kind of give you an update on what we're seeing in terms of the economic impact of COVID-19 through the economic downturn. Pre-shutdown, which occurred, we started seeing jobs shed really the last part of March, not only here, but across the country. And through the end of May, which is the most recent report through the Virginia Employment Commission, we're down 1,250 jobs during that period. So in terms of the impact of what that looks like, our unemployment rate went from 3.2% up to 9.1% as of the end of May. And to give you some comparison on how we're doing, kind of, comparatively speaking, the state of Virginia is at 9.2. So we're a tenth below the state. So, we're weathering the storm fairly on par with the Commonwealth there. We also know that roughly 92% of those job losses occurred the last week of March through the end of April. So in May, we saw 8% reduction. And my hope is that, the bleeding has stopped, and that when the June numbers come out, that hopefully we will have at least stabilized. What we're seeing at the national level at the end of May, at the end of June, there has been some jobs added back to the national economy. So I'm hopeful that we'll follow that trend as well. For us, the new world that we live in the pandemic going forward, from an economic development strategy standpoint, there are a couple opportunities, I think, going forward that we're well positioned for. So we're seeing some trends nationally about just more remote work, and that and this apparently was a trend that was happening with a lot of office pre the pandemic, but there was a trend towards more remote work. And currently now we're seeing a lot of the tech companies in the region, more office jobs, they're still working remotely, and larger companies like Google and Microsoft committing to there being remote work at least through the year, end of the year, and in some cases a vaccine is developed. So the remote work, there's been some surveys of folks that live in urban areas where living through a pandemic isn't as nice as it is here, that there's a perception, or at least an openness, to looking at more rural areas or suburban areas to move away from densely populated cities. So we're certainly well positioned for that here in the New River Valley with the amenities that we have, and through a lot of the initiatives that we have focused on tech workers and IT jobs. The other area I think is certainly COVID-19 exposed some of the reliances or over reliances we have on global supply chains. So there is some speculation that we'll start to see some companies reshoring some of the manufacturing overseas to ensure that there's less risk of this happening to us again in the future. And of course, we've already been the beneficiary of reshoring or onshoring of manufacturing in the New River Valley, with several companies in the last few years, from Italy to Colombia to Brazil, that have opened up manufacturing operations here, both in Montgomery and Pulaski counties. So I think, I'm always looking as an economic developer for that silver lining somewhere of, because the world will go on, and hopefully Dr. Bissell doesn't contradict me on that today, but I believe the world will go on. There will be a new normal, and I'm confident that the people here in our region will continue to adapt to the new normal and help us to stay competitive. So that's, talking about the pandemic and kind of where we are regionally onward in our own operations. But I also wanted to give you an update on some of the programs that we've continued to be able to execute despite the pandemic. So hopefully you've been reading your monthly Investor Insider, and if you have, you've seen that we've carried on with executing the NRV Experience program. And that's an initiative through our 5-year strategy where we want to work to help plug the talent gap by having more or increasing the number of college graduates that go to school here that remain here post-graduation. So we developed a program that allows them to go out and experience the different communities of the New River Valley during the summer while they're interning with a local employer. So pre-COVID, we had 10 companies sign up, a variety of manufacturing and IT companies, and they were going to enroll 57 interns in our inaugural cohort. Unfortunately, the pandemic, made that number go down, but it actually helped us because there was no way we could execute the program in this environment with 57 interns. So we continued on with the program, kicked it off the beginning of June. James has been instrumental in heading that up for us and making sure that we have all the protocols in place to keep the interns safe while we're showing them around the New River Valley. But so far, we held a kickoff event with them the second week of June, and then we've done excursions so far to Floyd County with a zip line excursion. We went on a hike at Mill Creek in Giles. Just earlier this week, we spent the afternoon at Pulaski County at Claytor Lake paddleboarding. Next week, we'll be doing a scavenger hunt on the Huckleberry Trail with the Roam bikes with Montgomery County. And then we'll wrap it up in 2 weeks with, remind me what the float will be in Bissett Park floating the river. So there's a lot of fun with these excursions, but we also have built in professional development sessions as well. So Acceleration has partnered with us to develop weekly videos that discuss things from soft skills to communication skills to emotional intelligence. And we have the interns actually watch those before the set or before the excursion. And then when they get to the excursion, we essentially lead them through a 10-minute session, interactive both ways, of how do you practically apply these skills to your internship and to your professional development. So far, we think it's going great. We just actually heard today one of the interns that went on the paddleboarding yesterday say that she felt like the group was really starting to develop relationships with each other, getting to know each other. So they actually hung out at Claytor Lake State Park afterwards together. And then another unintended benefit, I think, from this, through our kickoff event, we actually had an individual that goes to Georgia Tech that came here for an internship. And she actually thanked us. We asked for their feedback on what they thought at the end of the kickoff session, and she thanked us for hosting. She has no friends here. She doesn't know anything about the area. She was really excited to have an opportunity to actually not only get valuable work experience, but then going to spend her time this summer. So I think that shows the value of what we're trying to create, and we certainly look forward to continuing that out. We will be pulling together a video at the end of the experience to help show interns about what they think, and I look forward to sharing that with our investors when that video is done. And then lastly, this coming year, we're still kind of bobbing and weaving with the pandemic, but we have some initiatives that we feel confident moving forward on. So on business attraction this year, still don't know visiting trade shows. And so we're trying to adapt some more digital options to be able to help us do that from here when we may not be able to travel. We're currently shooting drone shots of 10 different sites and buildings within the region this week and part of next week, where those will be tools that we can use to help show and do virtual site visits with companies that may not be comfortable traveling right now. The cool thing is with the sites, we're working with an animator that will actually draw or animate what buildings will look like on the site. So to help, again, companies to understand what the potential could be there. Talent initiatives, hopefully next year we'll have a vaccine and we can bump our numbers up, and we'll be over 100 next year, interns enrolled in the NRV experience. And then we're also looking at ways to leverage the videos that we created this year around jobs in IT and tech and jobs in manufacturing, to essentially start targeting individuals, maybe particularly on the tech, on the remote work side of opportunities, and getting people to say, hey, you can move here and work remote. And then, by the way, we also have a number of tech companies that once we start hiring, you could work remote or join a local company. How about that? And then lastly, one of the other big initiatives we're working on right now is producing an outdoor video about the New River Valley. So we're going to be shooting that beginning next week and hopefully have it by the end of next month. But I think that plays well too with that remote worker type of strategy and messaging that, you know, I've been joking since the pandemic happened that people have been moving to the New River Valley since the 1700s to social distance. So we're used to, we moved here to kind of get away from the density, but still enjoy a very high quality of life. So with that, I'd like to turn it over and introduce our speaker, which is Dr. Noelle Bissell. Dr. Bissell and her husband, Charlie, moved to the NRV in 2003. They have 3 sons and a daughter. Prior to becoming the director for the New River Valley Health District, she practiced as a hospitalist and served as a medical director at Virginia Tech Shifford Health Center. Dr. Bissell oversees the health departments and approximately 55 staff in 4 counties, including Montgomery, Giles, Pulaski, and Floyd, and the city of Radford. And at this time, I'd like to invite Dr. Bissell up. Thank you.
So thank you very much for inviting me to speak today. I really appreciate it because I think point in this pandemic, I love this and that you actually chose an in-person meeting because, as you said, we do have to find a new normal. This isn't going anywhere. To be honest, if you know, when we get the vaccine or when we get through this, there will be another one in its place. With globalization and global travel, we have to expect that these kinds of things are going to happen. And hopefully we're learning. We didn't have a playbook before. So hopefully we're learning along the way of what works, what doesn't work, and how we can work together. We've been here since 2003. And in that time, even in that short time, the New River Valley has experienced events that have really challenged our resilience and our resolve. But the New River Valley has proven time and time again that this is a community that does work together and that does stand together. And nothing can be more critical in a time like this. I credit a lot of that to crisis leadership at some pretty high levels in our communities. And early on with the pandemic, we first started getting wind of how things were unfolding throughout the country. There were some key leaders who came together and said, we really need to address this and we need to take this on. So it started off with Montgomery County. They are our largest county. So that it's no surprise that they sort of took the lead, and they also have the towns of Blacksburg and Christiansburg. So it started off there, but it quickly grew to the entire New River Valley, all of our localities. Law enforcement, our hospital systems, our county administrators, our school systems, and they invited us to participate. I was very honored because they provided so much support for our public health initiatives. And there's no way we'd be where we are today without that support. You know, it's quickly grown. We recognized early on, you know, when people started talking about flattening the curve, and of course, we were learning this in real time, right? So we've known about this virus for months, not years, not tens of years or hundreds of years, but we were learning in real time that it could spread. We were learning that if not taken seriously and addressed well, that it could overwhelm our healthcare resources. And frankly, that was the biggest concern. When we talk about flattening the curve, and today on NPR was the first time I've actually heard it said, there's this misperception that flattening the curve means the virus go away, and that's not it at all. Flattening the curve just simply means that you decrease that slope of infections so you don't overwhelm your healthcare resources, so people can get the care they need. And those people, even though it's a small percentage overall that really need that critical care, that they get that care. And we don't fall into the category of having to ration care and people not getting what they need. Flattening the curve is not making it go away. It's just spreading it out over a longer period. And that was our main goal at the beginning. And we quickly recognized, if you remember, it seems like eons ago, but back in February, March, when we first started addressing this, testing was not readily available. There was a lot of concern, you know, about how do we deal with this? Is the virus here? How prevalent is it? And the only way to get tested was in our hospitals. And that was the last place we wanted people going, because we do know that most people are going to do fine And we didn't want everyone crashing our emergency departments and crashing our hospitals, because they needed to be available for the sicker people with COVID, but also the sicker people with all the other diseases that don't stop just because COVID was happening. So our localities and the task force, which is the New River Valley Public Health Task Force, they provided me resources, both financial resources, human resources, capital, everything, to take testing and set it up off-site. And we were actually one of the first localities in Virginia to start that. So little old New River Valley was one of the first localities to do that. And I give my credit a lot of staff, because a lot of credit. We didn't sit back and wait for people to hand it to us. I literally had staff on Amazon.com, because you heard about testing supplies, right? We couldn't get them. So we were looking everywhere. And we leveraged our partnerships with our universities and our partnerships with businesses in the community. And we were able to come up with the swabs and the tubes and the test media. So we were able to start testing. And that's where I came from today. We started our testing, our community testing, on March 31st. We've run it as much as 3 times a week. We've run it once a week. We have adapted to what the needs are in the community. We today ran over 200 people through in a matter of a couple of hours, and it never looked that busy. And that's because of the support. We've had law enforcement there, we had fire and rescue, we had public works, and they literally created this model, and I was able to take my staff and we go in and we do the testing. The other big thing that happened with it was the turnaround time on the tests, right? In the beginning, and even now, actually, the lab turnaround time was days to weeks. So you would get that result back, and you really couldn't do a whole lot with it, because at that point, when you go back to try and trace it, that person's already beyond their infectious period, and anybody they've infected has been infected. So we continued our testing, but then we reached out and we partnered in Fralin Biomedical Research Institute, a research lab. They flipped on a dime, became a clinical lab for us. And there were some growing pains, but it has been a wonderful partnership. They are not used to dealing with having to do data entry and personal information, and there's a lot of things that they're not used to doing, but they hung in there with us, and we've worked through the glitches. And so we're fortunate in the New River Valley. Today in the news, I think you hear that turnaround time on testing is going up again, because the labs don't have the capacity. As more and more tests get done, the labs don't have the capacity. With our partnership with Fralin, we do our community testing, and we have a 48-hour or less turnaround. And that's just amazing. That's just amazing. And that's really helped us handle our contact tracing, which is so important with this virus, that when we have a positive case, we get in touch with them. We figure out where they've been and who they've been in touch with, and then we contact those folks, and we can implement isolation and quarantine, and we can make recommendations for further testing. And yes, our cases have gone up, but we aren't seeing the exponential rise. We are in constant contact with our hospital partners to know where their capacity is and what their surge capacity is, because that's our gauge of where we need to be. And it's all because of this task force, and it's all because of this community spirit. Everyone here is taking care of each other. And we've rotated through to all of our localities, and every locality has welcomed us and has provided that support. So I think that's really, really critical. The other thing we really tried early on was consistent messaging. That's still a big problem. I think locally we've tried to do a very good job of it. I don't think anybody would disagree that at the federal level and the state level, there's a lot of inconsistency. And at a time where there's so much unknown, which in itself breeds some panic and some fear, and then you add on some new things, which we haven't dealt with before. Social media adds a whole new dimension to dealing with a pandemic. Social media spreads misinformation to tens of thousands, hundreds of thousands, millions of people with the click of a button. And, once people see that, they grasp onto it. And then it's very, very hard to change their mind or change their opinion. The other thing is, if you have an opinion, you can find anything on social media to support that opinion. And that makes it hard to change as well. And then the media, 24/7 news coverage, right? Gone are the days of Walter Cronkite and the 6 o'clock evening news. 24/7 news coverage leads to people looking for things to cover. And so it became the body count, it became all the death and despair, and there was plenty of that to go around. And I'm not saying that this isn't a serious illness, and I'm not saying that it doesn't deserve respect, but I'm saying that that total negative approach does us no good. We can't face this or any other crisis with fear and panic, because life will go on, and we have to deal with it, we have to respect it, and we have to learn. It's no different than the water and swimming, right? You can really enjoy the water and you can take advantage of it, but it can also be deadly if you don't respect it. Wearing a seatbelt, and wearing a seatbelt is a really big thing to kind of transition into some of our things here. You know, when I grew up, we didn't wear seatbelts, but we realized over time with data that they actually did save lives in car accidents, right? And so we all take it for granted now. We go in, we click that seatbelt, and it does save our lives. And it was a big push to get that change, and a lot of people were very resistant, but we're there now. Same thing with motorcycle helmets, bicycle helmets, those things. Not totally there. I think there will always be people who don't always agree and don't always comply, but as a community and as a group, we've gotten there with those things, and I know we can get there with this too. And so our messaging really needs to be to come together and take care of each other as a community. And I want to take the divisive politics out of it. I want to take the individual rights out of it. I want to take the don't tread on me out of it. I want to take the mandate out of this and just say, this is about us taking care of each other. And recognizing that for most of us, in fact, Stanford University and their epidemiologists came out with a white paper not too long ago, and they've been on par for over a month now with their modeling and their numbers, that for people under the age of 70, the death rate is going to be about 0.01%, not 0.1%, but 0.01%. So when we know that, we really have to shift our focus that we have to take care of that 0.01%, that most vulnerable population, which we know are our older folks. We know it's our folks with chronic medical conditions, autoimmune disorders, those kinds of things. And so we need to protect them. And the messaging has to be, yeah, it's probably not going to affect me that much, but I could then transmit the infection to someone who it could be deadly for. So no matter where you are on that spectrum, that this is a political hoax or this is Armageddon and this is the end of the world, you can acknowledge that there are people who get sick and die from this, mind you, like any other infection, like the flu, like meningitis, like hepatitis, like any other infection. And just as a community and in the spirit of taking care of each other, if there are things we can do to help protect those folks, especially if they're not a huge sacrifice, and if they really aren't a huge inconvenience, then that's what I want to. I want to engage our community to take care of each other and take all the other stuff out of it. And I'd love to get people off of social media and off the media and away from that 24/7 coverage for that reason. So that's been a big effort of ours. And right now, we're looking at a transition. We are opening things up, which we have to do. People tend to want to look at COVID through just a COVID lens, and we can't do that. There are so many other factors that come into play. And I'll just say, I agree that we did have to kind of rein things in and shut things down because we just didn't know what we were dealing with. And we really had a handle on it. I think our disease burden in Southwest Virginia at the time the governor shut everything down was low enough that we could take a step back and we could look at it and take it in and kind of come at it with a game plan. And we recognized, some of the things that we need to do to move forward. But shutting things down, and I know we all use social distancing, and even the CDC still says social distancing. I'm trying to change that to physical distancing because the last thing we want to do is socially isolate. We want to stay socially connected, but physically distant. Because when you look at some of the consequences we've seen, our overdoses and our overdose deaths are way up. Our substance use is way up. Our suicide attempts and completions are way up. Depression and anxiety is way up. And that all comes out of social isolation. these people need their communities, they need their support networks. And what did we do? We told them to go stay home, lock yourself in your house, and don't come out. And we do have a lot of technology that we're finding we can use to help us here. So we can stay socially connected, but physically separate. And you know, we have to look at those other unintended consequences, because to say that only the COVID death matters when you've got an overdose death or a suicide death or a heart attack death because someone was afraid to go get care because of COVID, we have to look at all that. So we can't just look through the narrow lens of COVID. And economically, and it's not all about the money. And I know that's the people on the extremes that want to talk about, oh, they're just interested in making money. They're not interested in their lives. Again, you can't separate those, because someone who's lost their job and can't take care of their family and can't put food on the table and gets depressed and either has domestic violence where they take it out on their family or themselves. So it's not just all about the money. It's about people being able to survive. And so these are all those unintended consequences that we have to look at. So we very much support, and we want to get things moving again. And we want to set a new normal. And the fact is that it really is not a lot that we need to do to get a good handle on this. We got very lax with basic infection control and prevention. Washing our hands, we have studies that people wash their hands about 20% of the time they really should. And that if people wash their hands 5 times a day, they could cut infections by about 40%. If they wash their hands 10 times a day, that goes up to 60 to 70%. Simple things like that, washing your hands, touching our face. And it's a subconscious thing. We all do it hundreds of times a day. But if it's behavioral change, I know that any behavioral change takes time and takes effort. But if we make a conscious effort, hey, I don't want to be touching my face to get my hair away or rub my cheek or whatever, because that's how infections spread. If you have it on your hand and you touch your face, that's how things spread. So again, a very simple thing, just an effort to change. What we call respiratory hygiene. I don't know how many of you are out in public and you'll see people just coughing or sneezing, just whoosh, right? If we just kind of bent over, what's that called? The dab, right? If we just bent over and cough or sneeze into our arm and then wash our hands, huge difference. So those things alone are incredible as far as infection prevention and control. And then the big thing now, masking, right? Outdoor transmission is exceedingly rare. So, I understand that a lot of people have a hard time wearing masks, but if you look at the countries who are doing well with this, they're actually the countries that started adopting mask wearing a long time ago. They stayed home when they were sick, or if they weren't feeling well, they put a mask on. And I know a lot of them did it for pollution, but they also did it for infection prevention and control. There was just that mutual respect for each other, which we need to get back to, and that personal responsibility to take care of our community again. And again, it's changed. And I really think if we could kind of set this new normal, we would notice that in flu season, because just to give you some perspective, we have a vaccine for flu, and yet we accept 30 to 80,000 deaths every year in this country from flu. And we don't bat an eye. We don't shut everything down. We don't change our behaviors. We don't go into hibernation. So if we adopt some of these and we collectively reset to a new normal, I bet we would see decreased deaths from a lot of other stuff, including flu, hepatitis, other things that can be transmitted, that are what we call communicable diseases, just by simple basic infection prevention and control measures. So, getting more bang for the buck. When you're inside in close quarters, in close contact, that's when we'd want you to wear the mask. Outside, the risk of transmission is exceedingly low. Take advantage of being outside. You don't have to mask. And so make it as minimally inconvenient as possible, and just say, hey, it's really not a big sacrifice that we're asking for you to get there. And that's a big part of our messaging. We're about to bring tens of thousands of students back into the community, right? So we need to message to them as well, that they're part of this community. We need their buy-in. We need their personal accountability. But we need to expect the same of ourselves as a community, because it's not fair to hold them to a different standard than us. The other thing we're trying to message is that COVID is here. So the students are not bringing COVID. They're not bringing it. It's here. It is all over the New River Valley. And so they could come here and catch it, just like they could catch it wherever they're coming from. So again, this is a collective thing. This is a community. They're part of our community, and we need to take care of each other. And the other big thing is, I don't want there to be considered, I know everyone talks about hotspots and everything else. I don't want there to be considered a hotspot, right? It's not where you go, it's what you do. And, I'll tell you, I have friends who went to Myrtle Beach, and I think getting out to the beach is fabulous right now. People are going stir crazy. People have been cooped up. They need to get away. The beach is one of the most relaxing things. The people that went to Myrtle Beach and kind of stayed separate on the beach, they cooked in or they got takeout. They really watched. They came back, and guess what? They were negative for COVID when they got tested because everyone panicked. The people that came back with COVID are the people that went to the bars where the music's turned up, so people are screaming to communicate. They're close quarters. Nobody's wearing masks. And so it was a predictable thing. So there's no bad place. It's bad behavior. It's not where you go. It's what you do. And, we're all in it together. And we've seen now that the governor is really looking at this more of from a regional standpoint, which we wanted all along, because we are not the urban population dense area that is obviously a higher risk. So we can kind of control where things go here. And that's our biggest goal right now. And right now we did see an increase in cases, but we sort of leveled off and started coming down with our 7-day running average. And we want to keep it that way. And that's our message, is just, let's take care of each other and let's do it so we can open up. We can get our kids back in school. We can welcome our students back, and we can reset that normal and get back to our lives and kind of find a balance there. We don't want to be on the extremes. We want to be in the middle, and we want to find that balance. So that's our big message right now. And I welcome every effort to and every opportunity to get that message out. And I hope people can get that message out even more, because I think we can do it. This community has shown that resilience, has shown that spirit, and has shown that resolve. And I'm proud to be part of this community, and I'm honored to be leading the public health response. So I think that's all I really had. I'm happy to take questions or have any discussion with folks.
One of the benefits of being here live is you get to talk to the experts. And the questions that you guys have, you can actually get to ask them. So feel free. We have an expert here.
What are the numbers that you track? What do you look at to see how we're doing? The newspaper publishes total number of cases, but that goes back to March, right? We're at 202 now. But we know it's a 2 or 3 week disease. Maybe how many people have it right now would be a better number.
So
Dr. Vessel, sorry, if you could repeat the question for the live stream.
So he's asking about tracking the numbers, and that the numbers you see on the website is just a total cumulative running number. How many active cases do we have right now? And that's a great question, and you're absolutely right. By and large, most people after a couple of weeks are going to be fine and recover, and everyone wants us to publish recovery numbers. That's a hard thing to do because we don't always follow up with people. Number one, a lot of them don't return our calls after they're feeling better. And number two, we don't have the staffing, the resources to do that. So what you'll look, VDH website now is starting to do kind of a running daily average of new cases. I'll tell you that our percent positive rate is still running under 5%. So today we did over 200 tests, and if we have 10 positive, that would be a lot. There's just not a good way for us to say how many active cases we are, because we can't follow. And recovered is a tricky word because we don't have that follow-up. Certainly some people get hospitalized, but a small percentage. And obviously some people do die, but again, a very, very small percentage. And the more information there is, the more you have questions and the more you can misinterpret. So even those numbers, for instance, I got a call the other day because we had been running at 5 deaths in the New River Valley, and then all of a sudden we had 6. That person didn't die recently. That death was actually from 6 weeks ago. And it takes time for the data to catch up, because the definition of a death related to COVID actually extends out 30 days post-diagnosis. And so that person happened to be an older person who had recovered from COVID, but because that person died within the 30 days, it got checked as a COVID death. So there's a lot of confusion around the numbers. And, I don't want people to follow them every day and take every increase. It's trending. Our trending numbers are actually doing very well. The bottom line is we will have some community transmission because there is no vaccine, and we are certainly not close to natural herd immunity from infection. So what we want to do is control that, kind of a controlled burn, so we don't overwhelm our healthcare resources, but we sort of get through this until we either get herd immunity or we get a vaccine. And the trials are starting to look promising, which is good, although long-lasting immunity is not. So we are trying to put that more relative data of new cases per day. Can I tell you how many active cases? There's no way I can tell you how many active cases we have other than, our death rate's not going up and our hospitalization rate's not going up. So you have to recognize that most of those people are recovering within a couple of weeks. So as we get 10 or 12 new cases a day, there's somebody coming off too. And it's just really challenging to follow that with anything that people want to see. And that's not something so important to me. What's important to me is that we can handle the cases we're getting, that our hospitals are not being overwhelmed with those cases, and that we're not seeing increasing deaths and significant problems there. And then we can assume those people are recovering. So basic cleaning is fine. You don't need to SurfPro. Transmission from surfaces is very low. And it's not that COVID jumps off and gets you. It's that you touch the surface, you have it on your hands, and then you touch your face. So if you're washing your hands and you're not touching your face, you're not going to transmit it through surfaces. So a simple cleaning and wiping things down with the usual EPA cleaners is fine. It can last on different surfaces for different amounts of time. But again, if we get into the habit of washing our hands and not touching our face, that doesn't matter. It's not going to jump up at us. So I think just regular cleaning, regular precautions, wash their hands and don't touch the face, and you're good. You are not going to get COVID that way from a surface transmission.
I think we have time for one more question.
So how do we field all these other infections as flu season and strep throat season and everything comes up in the fall? And that's actually on my mind every day. We will be doing a big flu vaccine push for sure. And I would encourage everyone to get vaccinated. And people talk about the flu vaccine only being 50 or 60% effective. That's kind of in the eyes of the beholder. To me, when the media says it's only 50 or 60% effective, they're saying, well, it only prevents flu 50 to 60% of the time. But to me, that's better than 0% of the time, right? 50 to 60 is better than 0. But the more important thing is that if you get vaccinated, even if you get the flu, chances are you are going to have a less severe course of the flu and you aren't going to get the complications and you aren't going to die. So to me, that means the flu vaccine is way more effective than people give it credit for. So it does at least take that out of it a little bit. And again, if we stick with these precautions, the hand sanitizer, the hand washing, the not touching our face, basic cleaning, respiratory hygiene, and masking, I think we're going to see a lot of that go down. And that's why, you know, there are so many reasons to make this big push right now for simple things we can do that will help us with COVID, but will help us with all that other stuff too. You know, strep throat, kids get strep throat because they're sharing their drinks and their food and their lollipops and everything else, right? So, you know, probably not a good time ever to really be sharing at the level our kids like to share. And that'll cut down on strep throat. You know, touching their faces and their slimy, snotty faces, you know, we have to really coach our kids. Hey, you know, let's wash your hands. Let's not do that. And I think those things will make a big difference. It is definitely a concern as we move into flu season because they present very similarly. Is this COVID or is this flu or is it both? And the risk of that. So actually right now is the time that we really want to do our best to kind of get COVID controlled before we bring flu and the other stuff into the mix.
We want to thank Dr. Bissell for her time today.
Thank you very much.
Let's get across here. We also have the thank you gift right there. That's for you.
Oh.
I'll let you pick it up. It is from Nancy Creed from Orange Bandana Gifts.
Wow.
She does a great corporate gifts for us, and she put that
Oh my
together.
gosh. Thank you
Yeah,
so
so we
much.
just want to thank you for your time and your expertise today. So,
Wow.
yeah,
I
so
appreciate
thank you.
this. Thank you.
Yeah.
Please reach out. I'm pretty accessible. Email, my phone. And, you know, misinformation is our biggest enemy right now. So if you have questions, please don't hesitate to call the health department, call me, email me, you know, because misinformation, if we can stop the spread of misinformation, we're in a much better place.
Thank you.
Thank you so much, everybody. Thank you.
All right. All right, everyone. This concludes our live stream portion. For those of you tuning in, we wanted to say thank you. Again, this is our first time. I know we had some technical difficulties at the start, but hopefully we'll be able to continue to bring you live events, our quarterly events. So we do. We want to thank you for those of you that are tuning in that are investors. We couldn't do these events without you. And if you're tuning in and you're not an investor, please reach out to me. Again, my name is James Cabler. I'm Director of Business Engagement. I would be happy to talk to you about who we are and what we do and our mission. So thank you guys. And for everyone here, thank you for coming. You'll have access to the bar and food. So thank you.